so often people will call, and when I pick up the phone, they express so much gratitude for even being able to talk to somebody.
Right.
And when they say things to me like, "Oh my goodness, I called such and such hospital and they told me that they have a wait list for 6 months to a year. We're so grateful that you could get us in." And I find myself feeling that frustration when I
Yeah.
call a doctor's office and have to wait 2 months for an appointment. So the idea that we can get people in immediately and start getting them help immediately is so exciting.
Well, I mean, both of us worked together up at Stanford before we started this. And when I left, and you left a little before me, when I fully left, I mean, the wait list was a year. And now, because we still have colleagues up there, they send us clients all the time from Stanford because they can't see them for a year. And even if you get on that wait list for a year, you're lucky to even have that, because a lot of people can't even do that.
Good point. Actually, someone recently called and they said that some of these larger facilities, hospitals, larger clinics have actually discontinued their wait lists
Yep.
because it's so far out.
It's crazy. Yeah.
So, when we tell people, we can absolutely get you what you're calling for. If you want a comprehensive evaluation, we're going to give you that to you. And while you're waiting for that, let's start helping you now.
Okay, so to me, this completely turns upside down the industry. Like, what do you mean everybody else has a 2 to 3 month process and a wait list and all this stuff? Dr. Barrett, how in the world? What are you talking about? You can see me within a week or two and get somebody started on feeling better and accommodations right away. Like, how are you doing that and nobody else is? Like, what are you talking about?
I think what it boils down to is that when somebody comes to us, our goal is beyond the assessment. It is beyond getting you accommodations at school and getting you a label. What it's really about is helping you now to get what you ultimately want, which for the majority of people who call us is not accommodations and is not a label. It's, I want to help my kid. I want to help my kid be the best version of themselves. I want my kid to not come home crying every day from school because they're so overwhelmed. I want my child to have successful relationships. I want to change the path my child is on because right now they can't pay attention in school. And so they're not learning anything. They're feeling overwhelmed. They're thinking that they're stupid, but they're really bright. How do I change this around for my kid? And so that's where we come in.
Yeah.
And what we're able to do is start them right away on this truly transformative process now and get them on the path to changing their child's life now while they wait for the documentation they need. And so in doing that, if we're able to do a few start out off the gate running with a few basic assessment measures and give them a little letter to their school so they can get some accommodations immediately that are going to help them while they wait for the greater assessment, now we've got them going immediately instead of waiting 3, 6, 8 months down the